And I will be discussing mental illness in this video for our Module 4 assignment. Please excuse my congested voice. I became sick over the weekend. First, I wanted to briefly discuss what mental illness is before jumping into the scenario-based question. Mental illness simply pertains to illnesses affecting the brain. Per Mala 2015, mental disorders can present through a range of experiences that alter an individual's perception, their thought and consciousness about the self and the world around them. Many people are at risk for mental disorders. In fact, per Holland 2018, 1 in 5 American adults experience some form of mental illness every year. This can be influenced by traumatic events, financial strain, substance abuse, stress, and other common issues. The scenario for this module states that the Emergency Medical Service, or the EMS team, brought a 54-year-old patient to the emergency room where I'm working. The emergency medical technicians claim that a jogger found a woman wandering in a park who had injured herself after screaming obscenities at the jogger. The woman had fallen, scraping her arm and her face. The woman is combative, disoriented, bleeding from her wounds, and accused the EMS team of stealing her purse. She is shaking severely and is yelling that she needs a bottle. She also smells of stale body odor and urine. So to start, we're going to break down the scenario. It appears that the woman could potentially be homeless or may not take care of herself due to her mental condition. It seems that she has a disorder that affects the way she behaves, since she's yelling at people who are trying to help her. She also might have a substance abuse problem because she wants a bottle. This scenario was a little tricky to interpret because there could be many things affecting this woman. She could also have multiple mental health issues, which is true in many cases. My first thought was that the woman has schizophrenia because she's combative and yelling obscenities. If you've ever witnessed a schizophrenic individual, they tend to yell and talk nonsense. They also wander around aimlessly, and many of them are homeless or appear to have poor hygiene because they are delusional and can't properly care for themselves. After thinking about the scenario, though, I've concluded that the woman is suffering from substance abuse and withdrawal. Substance abuse accounts for symptoms of combative behavior when a patient is no longer feeling the effects of the drug and can make a person disoriented, shake from overactive sympathetic nervous system, have balance issues, and demand more of the substance so that they don't feel the effects from withdrawal. The only hint that is given in the scenario is that the woman wants a bottle, which could indicate alcoholism. However, that does not mean that this is the only substance she's using. It could also account for poor hygiene, since many drug abusers either don't care or aren't aware of their current state of self. Drugs often take over the mind and consume the affected individual. So, second question, what are the short and long-term health risks you would expect the patient to face? The patient is at risk for health-related concerns in the future if she is not treated for a condition or is non-compliant. Some short-term health risks for the patient based on alcoholism and substance abuse include injuries, such as her scrapes that she obtained, violence, alcohol poisoning, or overdose of other drugs, risky sexual encounters, and sexually transmitted diseases, per the CDC 2018. Short-term effects of poor hygiene include risk of infection, poor nutrition and water intake, and dehydration from lack of water and GI-related symptoms. This includes diarrhea and vomiting. Short-term psychological risks include depression from alcohol, anxiety, mental confusion, and delirium from sleep interruption. Some long-term health risks include high blood pressure, heart disease, stroke, liver disease, higher risk of cancer, dementia, social problems including not holding up well in society, and alcohol dependence. Depression can also be considered a long-term risk if the patient continues to abuse the substance. Third question, what is causing the patient's shaking? The patient's shaking is most likely due to symptoms of withdrawal. Alcohol is a depressant and affects the central nervous system. If an alcoholic stops drinking after the body is used to having the drug regularly, the nervous system can be overstimulated and not know how to adjust back to regular function. Per Harvard Health 2019, this can cause tremors, hallucinations, withdrawal seizures, and delirium tremens, which causes dangerous shifts in breathing, circulation, temperature control, tachycardia, and hypertension. Per Moine 2018, alcohol withdrawal is severe and can be life-threatening. Fourth question, what assessment should be taken for this patient? The assessments that should be taken for this patient are blood alcohol level, along with other drug tests to see if she is positive for any of the drugs. A physical examination, including blood pressure, pulse, and temperature. Also looking at her pupils for constriction or dilation. A mental status and psychiatric evaluation, a basic blood chemistry panel to assess vital organ function, and a urinalysis to check for alcohol, and a urinalysis to check for infection as well. This was based off of her smelling like urine. We should also check to see if the patient is dehydrated. Okay. For the research question, it deals with mental illness management and insurance coverage. Mental health patients usually need both psychotherapy and medications like psychoactive drugs, per Moine 2018, to stabilize or control their disorders. There are ways of managing both and giving the patient access at lower costs. This is called managed care and is offered to mentally ill individuals. Per Medicaid.gov, managed care is a healthcare delivery system that is organized to manage cost, utilization, and quality that provide health care services at a set per member per month payment for these services. Per Friedman, 2019, insurance benefit features determine access to specialty mental health care. There are flaws in the system where patients need to meet certain requirements in order to receive the care to be qualified. However, due to the Mental Health Parity and Addiction Equity Act of 2008 and the Affordable Care Act of 2010, there has been some success in helping mentally ill patients not have as high of copays or deductibles. There are still some discrepancies, though, with insurance claims and what they cover for mental illness. In order to make things better for the mentally ill, healthcare providers must come together to determine what these patients need to have access to. Insurance companies will not budge unless healthcare professionals and politicians bring awareness of the issues. Mentally ill or unstable people need extra help to be able to function in everyday life. Thank you so much. I appreciate you listening.